Another common concern for men, and most of these are younger men, would be gynecomastia, which is male breast tissue. So when a young boy is going through puberty, a large percentage will develop breast tissue because of the hormonal changes they're going through. About 90% of those boys the breast tissue will just spontaneously go away by the time they've reached 18 or 19 years old. But in a small percentage, the breast tissue stays and it's not functional. But what can happen is this can be obviously a real source of anxiety, and you'll have kids who come in and they haven't gone without a shirt for years because they're embarrassed of their chests. And so when a young man comes to see me who is concerned about the appearance of his chest, well, first I have to assess, is it true gynecomastia, which means is it glandular, or is the patient slightly overweight, which is just causing there to be excess fatty tissue? Most commonly, it's the former. Most commonly, these kids are people who are athletes, not necessarily overweight, and one of the reasons why they're not is because they think if they lose weight or if they work out, they'll get rid of the chest or improve the appearance of the chest. So gynecomastia would involve an incision on the lower one half of the areola from the 3 to 9 o'clock position, removal of a part of the breast tissue itself, and then liposuctioning around that to contour it. It's very, very unusual that you can just completely improve glandular gynecomastia with just liposuction. And if that is tried, that's the most common reason why there is a revision needed, because the suctioning is done. When the person is lying down, you may not see the remaining gland, and then as the swelling goes away and they're sitting up, or you see them when they come back, you'll see, oh yes, there's glandular tissue there. So if you assess that there is gland before the procedure, then you should do excision and suctioning of the gland. And it's a very nice procedure. Most people who do it are very happy.